So to start us off, is a VED the same as an internal pump device with saline?
No, very different. So the internal pump device with saline would be a penile prosthesis. Okay, so that's an inflatable penile prosthesis. This is totally, completely different. Vacuum erection device is a vacuum device that we've been showing that is external. And again, all these are treatment for erectile dysfunction, but it's not surgically implanted. The penile prosthesis is surgically implanted. Totally different treatment option.
Alrighty. Next question here. Once the vacuum erection device is removed, how long will you remain erect enough for penetration?
That's a loaded question. The goal is the entirety of sexual intercourse, but no more than 30 minutes. So the goal here is to be able to use these as a tool to be able to have an erection that is 100% rigid and sustainable enough for the entirety of sexual intercourse every time you want it. That's a realistic goal. That's what we're looking for. So obviously, if you're using it and you lose it and you're not able to, you lose it before you're able to achieve that orgasm, we haven't achieved our goal yet. And that's, of course, where continuing to use a vacuum erection device to help regain and rehabilitate or combining it with other therapy would be an option.
Alrighty, let's go to the next question here. So this is a bit of a repeat, but perhaps we could rephrase this. So we're talking about side effects, and maybe you could talk about the most common side effects you've seen in your office.
The most common side effect that I see is discomfort. And it's usually more of a technique issue, okay? So again, some of those tricks that we talked about, shaving the hair around the actual area where the phallus connects to the base, using enough lubrication, making sure you size it right, making sure that the actual vacuum itself has a good seal. So discomfort from the actual vacuum is the most common side effect I see. The second most common would probably be that those petechiae, so little tiny bruises that you can get. And that's because, you know, when I see that, I tell my patients, you're doing a good job. I know they're doing a good job at that point because that's from usage. And again, learning the technique, this should not hurt. Using this, if you're using a vacuum erection device and you're having pain, you're not doing it right, or you're being way too aggressive, or you don't have a medical grade pump like the one that Owen Mumford has, because it doesn't have that pressure regulator on. So those are the two more common scenarios I see. Of course, there's always a scenario of not working well enough. It just doesn't get that right suction, doesn't get that seal. But again, most of these are treated or managed by practice, going over techniques, learning how to use it appropriately.
For sure. Alrighty, next question here. Is it ever too late to begin or resume using a VED?
No way at all. It's never too late. It's never too soon. I think, as I've alluded to, I've had patients who don't even have erectile dysfunction, but they use it. Same reason you would go and work out to the gym, exercise. And I've had men who have gone years without having intercourse, had no interest in it for whatever reason. Maybe they had a partner that was sick. Maybe they didn't have a partner, or they had other things that they had to deal with. And at some point they said, okay, I need to get my penis back in order. And this is a wonderful way to try to regain what they've lost over those years.
Certainly. Alrighty. Again, a little bit of a review, but perhaps we could focus this one on some of the advantages for people with dexterity issues. So what is the difference between an electric and a manual VED?
Yeah, so it all comes down to the head of the actual pump. So if you don't have good dexterity issues, this is probably not the best option for you. It takes a good amount of strength to be able to do that in dexterity. The electric ones have a button that when you press, it starts the suctioning all by itself. And so for men who don't have good dexterity, that's a wonderful option. And let's not forget, it takes two to tango. If you have a willing and able partner, why not teach them how to use a vacuum device? Obviously, you need to be very verbal and talk to them about if it's hurting or not. But the difference really is the head of the actual unit. The unit itself practically looks the same and works the same. The difference is being able to manually squeeze it versus just pressing a button that will then create that negative pressure that we're looking for.
Alrighty. Next question here. What are the guidelines for picking a non-medical quality VED, if this is even recommended?
It is not recommended. There are no guidelines. The guidelines say if you're going to get one, it should be a medical grade vacuum erection device.
Alrighty. Next, we already kind of covered that one. So I guess this is a good question to ask again. Does the using a VED increase the size and or girth of the penis?
Absolutely. Absolutely. It's probably the safest and most effective way of doing it. Now, unfortunately, it does create kind of an optical illusion. I have some men that they'll, on the actual tube, they'll mark it off with a Sharpie to see, and then they tell me, well, that's my real penile size. I said, no, technically it isn't. But if you use this, you will notice a difference in natural erection and, more importantly, natural flaccidity. A lot of men will use this. They're not even sexually active. But they tell me, man, when I go to urinate, it's a tragedy every time. By using this, it's a fantastic way of getting more of that penis to stick out, having more of that outing. So even beyond sexual reasons, it's great for overall penile health and function.
Certainly. Next question here. Can this device help eliminate Peyronie's disease?
Absolutely. Absolutely. All of my patients who have Peyronie's disease, I encourage them to get a vacuum erection device. I have a protocol that I use, and within that protocol is a vacuum erection device. Sometimes it can be a little tricky because with Peyronie's, and let's define Peyronie's, it's a curvature of the penis because of a plaque. As the penis is getting erect, if the penis is bent, you may have some issues with rubbing up against the actual tube. Again, lubrication a lot of times will help that. Initially, they may not be able to get as many pumps in because the more rigid they get, the more bending, or the more of that bend may be more prominent. But if you can slowly work your way into it and use some of the other therapies, these vacuum erection devices are wonderful for Peyronie's disease.
Certainly. Alrighty. If the VED loosens plaque in the penis, does this risk a cardiac event?
No, it does not. The good news is the plaques in the penis will not become a plaque, an embolus that will go to your brain or your heart. It doesn't really work that way. Neither a Peyronie's plaque or the atherosclerotic plaque of, say, the corporal artery. So that you don't need to worry about that ever happening.
Alrighty, moving right along. Can you explain how it's possible to still achieve climax with the tension ring in place at the base of the penis?
There are three, the components of that, the culmination of the sexual act, which there's two parts really. You have the orgasm, the violent contraction of the muscles in your pelvis. And then you have the ejaculation, which is the fluid that comes out. You're going to have an orgasm because having that ring at the base doesn't really hinder that, doesn't change that at all. Quite the opposite. Make it better because you're going to have a better erection. But what more than likely will not be happening is an ejaculation, because if you have your penis, your urethra runs down the bottom of it. You put a ring on that, that's strangulating the ring. So you're not going to see something typically when you have the orgasm because it's blocked up. Now, when you take the ring off, you may see something come out at that point. So that may happen. If you're seeing something with an orgasm with a ring on, that ring's not on there very tight.
Alrighty. Next question here. Why does it feel like I lose sensitivity with the ring left on?
Running on the top of the penis, you have the neurovascular bundle. That neurovascular bundle is what creates and gives that sensitivity, that sensation. So when you got that wrapped around there, that's why you get, sometimes they call it the cold penis, that blue looking penis, because that penis, unfortunately, you're strangulating those nerves. So that's why, that's also part of why we say you don't want to leave it on for more than 30 minutes. So some people are a little more sensitive to that and they can't tolerate it at all. Most people are able to tolerate that.
Alrighty, a little bit of a repeat here, but great question nonetheless. How often should I use the VED? And I guess this could vary on what your use case is.
That's correct. And when I tell people, use it as often as you can, whatever you can fit into your schedule. Don't think of this as being such a strict thing. If you could do it once a month, fine. You can do it once a week, fine. You can do it once a day, fine. The more you use it, the more likely you are to see a benefit from it. I use the rules of three. 3 times a week, do it for 3 sessions with each one of those times, hold the erection for 3 minutes. It's easy to remember that way. Most men will find some sort of routine and some groove, usually before they shower. They got it in the bathroom hidden somewhere, and they'll just cycle it and do their exercises.
Alrighty. Saw this one a few times. So how effective is using the vacuum erection device in combination with PDE5s such as tadalafil or sildenafil?
Again, pretty loaded question. It's very effective. It helps enhance those treatments, so I encourage it. For rehab purposes and on-demand sexual purposes, number-wise, I couldn't tell you what the success rate is because I think it's a little loaded in the sense that it depends on the severity of the erectile dysfunction. But you can throw the kitchen sink at erectile dysfunction, especially with this modality. It's a wonderful way of being able to treat it because you're not really, it's a totally different pathway. So you're not increasing side effect risk as if you were to take, say, a double whammy of Cialis or Viagra. So I encourage doing this taking different approaches and attacking it from different angles.
Alrighty. Couple of similar questions following that one up, but can the vacuum erection device be used in conjunction with trimix or bimix?
As well, yes, you can. Absolutely. Some guys will use it before injection to get more of that penis so they can see the sides a little bit better. Some will use it right after they inject to get things going a little bit more. So you can absolutely use it in conjunction with the trimix or the bimix.
Alrighty. So in a single session, how much pumping is too much? When should one stop before risking damage?
If it hurts, stop. Once you get that 100% rigid erection, stop.
Perfect. Alrighty. Let's see. This question I thought was pretty good. I don't usually see this one, but please explain how to use a vacuum erection device for penile stretching pre-implant surgery.
This really became very popular about 10, 15 years ago. There was a urologist from Daytona, may he rest in peace, Martinez, who him and his PA Tom Sellers really did a very good job in showing how using a vacuum erection device can help regain length prior to placing a penile prosthesis. Now, yes and no, because what is stretching is a lot more of that soft tissue. And so that's why it's very important, this optical illusion in the tube, it's going to look a lot longer than it does in the natural setting. With an implant, we're limited by the corporal space, which the corpora cavernosum, the tubes that fill up with blood in the penis, are surrounded by the tunica virginea, which is the second toughest membrane in the body, second to only the dura in your spinal cord. So to stretch that, it takes a lot. But this is one of the many factors and things that we can use to help regain length and get a longer penis. Having the implant in place actually is probably the most effective way because now you're stretching from the inside out. So that's really making that very tough membrane stretch out. So you can use it. I encourage it. But again, realistic expectations. I tell guys what you're seeing in that vacuum device is not what you're going to get in real life, unfortunately.
Alrighty. How often should a vacuum erection device be used for training / reconditioning on a long-term basis?
Again, whatever you can fit into your schedule. There's no set amount of time that you should be using it. It's whatever you can do. The more you use it, the better off you are going to be. Obviously, I don't want you guys out there playing with your penis all the time, but whatever you can do within reason, go for it. The more you do it, the better off you'll be.
Alrighty. What can be done if the penis gets hard, but it is soft behind where the ring sits?
So it's about the right fix. That's a very high likelihood. So if you got the ring midway down the shaft of the phallus, yeah, you're gonna have sort of a semi in the proximal part. So you really want to get a good fit all the way down to the base. The penis isn't just the part that sticks out. You got a deeper part, which is the crus, which unfortunately won't fill as much. So you're not going to have that erection for the most part that sort of sticks up like that. It may be more of a straighter erection, but it's going to be something that you should be able to manage and use for penetrative intercourse. Combining these treatments may help that base part of the penis fill up a little bit more. So one, making sure you have the ring all the way down to the base, and two, combining to try to get more blood flow in the proximal portion of that cruise may help you get that more uniformity in that erection. But even if you got a good seal all the way down to the base, you're gonna have that external part of the penis that's rigid enough that although it may not be sticking up like this, it may be a little more sort of horizontal, you should be able to use that.
Alrighty. Bit of a follow-up to the long-term reconditioning question. How long does it normally take to see results from rehabilitation with VEDs?
You can start to see it after a few weeks of using it. On the slides here, they talk about 2 to 3 weeks. So after a few sessions, you may start to notice a change in that. I think a lot of it depends on the severity of the erectile dysfunction. I have guys that say after their first session, wow, they say they're seeing more penis, they're having better erectile spontaneous erections. Very similar to what we're actually seeing also now with the shockwave therapy. These are really two, shockwave therapy and vacuum erection devices, are what we use a lot for regenerative rehab purposes. So depending on the patient, a young healthier guy may start seeing something right away after just a day or two. Others, depending on where you read, 2 to 3 weeks, and some take a few months to really start to see any changes.
Alrighty, we have another clarifying question on that. So can you clarify on the timing of the pumping and holding and then repeat for the reconditioning process?
So on the actual slides, they say 1 to 3 minutes, which is, again, why I use the rules of 3, because across the board, that's what most people say. But you're going to read all sorts of different things out there, which is, again, I don't want people to think about this as so black and white. You can play around with this. You don't need to do it exactly by the book. You can figure out what's going to work for you, because in the end, it's all about cycling, filling, deflating, cycling, and tricking your penis into thinking that, hey, I'm healthy. This is what you're supposed to do. You're kind of teaching it. But if you go by the slides, or what I call my rules of 3s, you want to do 3 sessions, 3 minutes each, more or less. When you say 1 to 3 minutes is what you want to maintain a good rigidity before letting it deflate.
Alrighty. Does the penis need to be partially erect before starting the VED session?
No, you do not. You can go completely flaccid, and with the actual vacuum device, you're going to start to see the erection appear.
Alrighty. Let's see. This is a bit of a review, but great question again, nonetheless. So how do I know if I'm a candidate for a VED?
Everybody's a candidate for a VED, bottom line.
There we have it. Alrighty. Can patients who have had a cystectomy use the vacuum erection device?
Yeah, I think a lot of the attention has been placed on men who've had their prostates removed only, and they don't talk about men who've had their bladders. It's usually bladder and prostate together. And the answer is absolutely. I think men who have had radiation, pelvic surgeries, pelvic fractures, cystectomies, which is removal of bladders, removal of prostates, anybody who has had some sort of insult to their penis should consider using a vacuum erection device to help rehabilitate it.
Alrighty. This question has a set number of years, but does this therapy work for any person that has undergone a prostate surgery, regardless of how many years out they are?
Yes. It's never too late.
Alrighty. Can a diabetic and insulin patient use this device?
Absolutely. I think they're the ideal candidates because you're trying to get that blood flow into the corpora to help treat some of that scarring that the diabetes has created.
Will a VED work on someone who has received penile enlargement enhancement?
Yes. Now, with that said, take that with a grain of salt. Whoever did your surgery, you want to discuss that with them first, depending on what they've done, what they've used, whether it be a filler, whether it be an actual prosthetic. Because what I don't want is for you to start using it and then end up with a complication with something that you have invested time and money to try to have your penis look a certain way, depending on what the cosmetic surgery is. So the answer is yes. Technically, you probably could, but run it by whoever did your surgery because they may not agree with me. They may say, no, you don't want to do this for X, Y, and Z reasons.
Can you use a vacuum erection device with an artificial sphincter implant?
Yes, you can. An artificial sphincter is a sphincter that's placed in the urethra to help with incontinence. Should not make a difference. You should be able to use a vacuum erection.
Sounds good. Alrighty. Let's see. Similar question here from the chat. This person says, I have had hernias in the past. I do feel sore at times while using the pump. Should I be concerned about this?
I would recommend running that by your general surgeon just to make sure that you don't have a recurrence of the hernia. I can't imagine that a hernia would have to be a very big hernia to get in that way. But if you're having pain at the hernia site with any sort of manipulation to that area, including a vacuum erection device, seek help and get checked by your general surgeon, especially whoever did the surgery.
Alrighty. Let's see here. Next question here. I think we already covered that, but I guess can you use a VED if a person has an IPP?
You could. Now, again, with that said, I don't really see a reason behind it. If what you're looking for is more length and girth and size, you should cycle the implant. You cycle an implant every day, you're stretching the corpora out, and you're going to start to see an improvement in your length and girth.
Alrighty. Now, this question has also come up a couple times. Is a VED good for men who have venous leakage?
Yes. Venous leak meaning that the penis won't trap it. So the blood flows in, but the penis doesn't want to maintain it. You use a VED, one, of course, for rehab purposes, but you can also use the ring to put it all the way at the base and help prevent some of that backflow. So the short answer is absolutely yes.
Alrighty. Little follow-up question to that in the chat that just came in. What do you suggest for venous leakage? Is there medicines or other treatments that can help this besides a VED and or ring?
Depending on the severity of the venous leak, if it's very severe, the best treatment is probably a penile prosthesis. With that said, you can still try all the different treatment options out there: phosphodiesterase inhibitors, injections. You can also use the vacuum erection device. Some of these older therapies that were out there, like a superficial dorsal vein ligation, don't really use that anymore. Unfortunately, they were riddled with a lot of complications and really didn't do much. So the short answer is, yeah, you should try to do a lot of different treatments just to see if you respond depending on the severity of the venous leak. But of course, ultimately, if nothing works, you always have the penile prosthesis, which will work.
Alrighty. Next question here. Will using injections and then the vacuum erection device cause bleeding at the site of the ejections?
Say that again? Oh, using injections at that site, might they bleed? It shouldn't. It shouldn't. If you hold enough pressure and you wait enough time, you're talking about a needle that's about 31 gauge. So it's very, very, very thin. It's the insulin syringes. So hypothetically, could you? Yeah, but that hole is so small that usually once you inject, you hold some pressure on there, you shouldn't have that issue.
Alrighty. Another question here from the chat. Should we put the ring on during pumping or just after?
It depends on whether you want to use it for intercourse or you're just using it for rehab purposes. For rehab purposes, there's really no point in using the ring. If you're using it for intercourse, sure. Yeah, you pump it up and you put the ring on after you are erect. That's the key.
Certainly. Alrighty. Is there any specific model or VED of device that you know of that can help reduce the testicles being partially vacuumed into the device?
No, that's usually related again to the actual seal. So, that's happening. You may want to get the skinnier one, which will prevent the actual scrotum and testicles from being sucked in. So if you got a smaller opening like that, you're going to have less of the actual scrotum getting sucked into the actual VED. So that's usually, again, it's a technique issue. But there's no specific model or vacuum that's going to prevent that, made for it to prevent that.
Alrighty. Not sure if this is relating to VED device use, but this person is asking, can a dry orgasm cause harmful internal pressure? I think it does.
No, no, it usually does. I mean, the dry orgasm, meaning nothing coming out. I've had some men complain that creates some discomfort in them. It's the dry orgasm is usually related to either anejaculation or retrograde ejaculation. So it technically should not. Also using the ring with the vacuum also technically should not cause pain, because one way or another, if it goes retrograde, you're going to urinate it out or it'll dribble out. Or if you have anejaculation, then it's nothing's coming out. So a lot of men do have other pathology that could potentially cause pain with orgasm. That may also go with no ejaculation. Prostatitis can do it. Pelvic floor dysfunction can do it. So from the dry orgasm or the retrograde ejaculation, hypothetically, that should not create pain.
Alrighty. Next question here. What should you do if you're not rigid enough for intercourse after using the VED?
So if that's not working, you got to talk to your urologist, because if the vacuum erection device isn't enough, there are other options that we can give you, and not only to replace the VED, but to do it together with the VED.
If I have used the VED for 30 minutes, how long must I wait to use it again? And I'm sure this is for the reconditioning process.
So if they use the VED for 30 minutes, how long? So again, I think 30 minutes is more than enough time. I would probably wait at least 24 hours. There is such a thing as excess. And even though I keep saying it's no such, do it as often as you can. If you're doing it a lot, you're probably going to start to create some discomfort and pain. Remember what I told you. This process should not hurt. If it's hurting you, you probably need to reevaluate and see what's going on and what you can do to try to prevent that pain from happening. So it may be a technique issue if you're having pain. 30 minutes is probably more than enough for that one session. And you probably want to wait 24 to 48 hours for the next session, depending on how often you're doing it and what your protocol is.
Alrighty. It's going to be probably our final question for the event here. This person says, my doc said not to use Bimix with VED. Should I be concerned while using both at the same time?
So I encourage it. And I think if you have a urologist that says don't do it, you got to listen to them. You trust your urologist, is fine. Some urologists are a little more aggressive. The concern, one, of course, of priapism, having that erection lasting more than 4 hours, usually does not happen with a vacuum erection device. The concern of injury to the penis, again, with proper technique, you probably should not have a problem with that. If he's concerned, let's just say maybe that because you're an anticoagulation, the worry that with the injection and then you start suctioning, you might create more risk of bleeding. That's why it's a kind of a loaded question. You want to have that conversation with the person who's really taking care of you and you trust, because they're the ones that are really, in the end, responsible for you. That first slide that Ashton showed there, so important. These are little points here and there, but it's not meant to take the place of what your urologist told you to do. So if they told you that, listen to them. I would never go against what another person's urologist told that patient.
Certainly. All right, quick follow-up to that one. Should I pump first or inject first?
Again, it depends on what works for you. You can do either one.
All righty. And this person says that they joined the event a little bit late, so they just had a question about pubic hair, and they wanted to know how this affects the vacuum erection device process.
Yeah, so the trick is you got your penis, whatever hair is around the base, you probably want to shave that off, especially if it's long, because that's going to prevent a good suction, a good seal. So if you can do that at the base and then you use enough lube, you're probably going to get a better suction and seal for suction than you would if you had all that hair.
If you'd like to learn more about VEDs, there are plenty of resources on the Resource Center on menmd.com. You can visit this page to view instructional videos, guides, expert articles, and more. If you still have a question that was not answered on tonight's event and you'd like to speak to someone in person, you may call MenMD at 857-233-5837 or log into the password-protected MenMD portal to schedule an appointment with a personal health assistant. And to purchase a VED, you can purchase one on menmd.com on the shop page or the product pages, or learn about them a little bit more if you'd like to do so. And you can also call our office at 857-233-5837.
If you found this video helpful and want to stay in the loop with our growing men's health community, be sure to subscribe to our channel and click the bell to be notified when new content is available. Your support makes it easier for other men like you to find these helpful resources. Thanks again for watching. We hope to see you again.